Jose does have a strange infatuation with Xenos.
I do
Yes.
not. I do not.
Hey everybody, welcome to Clinic Talks, where two grad students talk like they know anything, and I'm one of your hosts, Micah.
I'm sorry, Micah.
And the one blushing like an idiot is Jose.
Whatever, Micah. Alright, so this is the dynamic. We're gonna be jumping first. We're gonna have our topics, main topics, right? Of course. Um, should we just? Well, obviously it's the first episode, so we have to go over and tell them how it's gonna work, right?
Yeah, so we're gonna have a few different sections of our podcast just to give it a little bit of structure. For the most part, though, the point of this podcast is for two people who graduated in undergrad together to continue to hang out and compare and contrast different graduate paths. I am graduating. I am in the program for counseling. Jose is in the program for ABA, and we've worked together in the past. We don't work together now. We want to keep hanging out. That's kind of the general purpose of the podcast, is to just have fun and talk about psych-related stuff.
So mainly the main focus that we're gonna be the main things we're gonna be focusing on are ABA and counseling. We do have certain parts that are gonna be a little silly and different, where we use our knowledge and what we have learned on the fields to apply it to fictional characters on video games, movies, you name it. We
Because,
can try and do it
we're not just psychology nerds, we're also nerds.
for reals though. So for the first section, we are actually gonna be talking about actual things from the field. We're gonna start today with counseling. So what's the topic for today, Micah?
So, the topic that I brought to the table is self-blame and self-doubt, especially with new counselors. I just started practicum, and so that's basically where, I am seeing clients, I am accruing hours and experience before I go forth and get my provisional license after I graduate. And one of the things that have been stressed to us is, sometimes clients don't come back. Sometimes they fall off the face of the earth, and that's not necessarily because of anything that you as the counselor did. Sometimes people just aren't ready, and sometimes, they need more time.
So when you mean that they fall out, do you mean that they stop going to counseling, or that the programming is not working for them?
It can be both. One of the most common ones is clients, showing up for intake, that first initial session, and then you never see them again. That happens a lot to new counselors and seasoned counselors alike, because it really doesn't have anything to do with skill. It can just be that, whoa, that was really vulnerable and intimidating, and I don't know that I'm ready for that. But there are also times where, you go in with a plan, you think that you've got a clear idea on what steps need to be taken, and the client's not ready to take those steps. Sometimes, counselors like to put that on themselves, like, oh, I messed up, I screwed up, or I'm not doing something right. 9 times out of 10, though, it's just the client isn't ready for that step, and that's okay. A session not going well, or not getting into any process or muck. People go to therapy to talk about heavy stuff, but sometimes that's not always how the session goes. It can't be every session. A lot of my cohorts in my graduate class have talked about how, oh man, I feel like I did so bad in this session because we didn't ever get to really talk about anything heavy. And a lot of our professors remind us, no, sometimes people need that. You're building rapport with them and giving them a safe place to be, and they're figuring out that that place is safe. And so I've seen a lot of counselors beat themselves up because they couldn't, they didn't have a particularly progress making session, and that's not necessarily on us. It's not because we did anything.
And I imagine this is also hard on the counselors themselves, right?
Yes, it's where this is something that a lot of new counselors especially have to deal with, because we're encountering these kinds of almost perceived rejections from clients for the first time. As you get more experience, you kind of figure out, okay, one, the client may not be ready. I may not mesh with that client, and that's okay. That's not because I'm doing anything wrong. It's just that that person needs a different approach, and that's fine. But a lot of new counselors struggle with that. What did I do wrong? How did I screw up? Am I doing what I need to be doing, etc., etc.
Funny thing you mentioned it, this reminds me to how new technicians on ABA react when the clients don't want to engage with them.
Mm-hmm.
Like they spend weeks trying to pair and create this relationship, and it doesn't really work out for them, and they start feeling like they're doing something wrong, and sometimes they don't understand that sometimes it just is not meant to be. Like every client is different.
Mm-hmm. Every client's different. Every client is at a different place and needs to take different sized steps. This is something I've been learning uh, in my practicum, is that, some people are going to want to they're ready to go. They're ready to take leaps and bounds and, move forward and progress. Some people, they need to take tiny little baby steps, or maybe not take any steps at all for a while, and that's okay.
What are some examples of things that you can do to prevent these behaviors from happening?
What
Is there like
behaviors
a way that you can
specifically?
is there a way that you can kind of like build a little bit this relationship with the client the first time that you meet them, to avoid them not coming back?
So this is kind of like the one of those key differences between counseling and ABA is 9 times out of 10, in ABA you're working with kids and the kids don't really have a choice. Mom and dad made them be here. Um, this has been a session on medication compliance. Set alarms for yourself so that you remember to take any prescribed medications by your doctor. um, but you always want to try to pair, as the ABA term for it, we call it building rapport. Um, and that's stuff that we're trained to do. But one of the key differences between ABA and counseling is that ABA is usually enforced by a third party, like a guardian or power of attorney, someone like that. Counseling, it's that person is there asking for help, and they can stay or leave or find a different counselor or whatever, and they have that choice. And we don't really have as much control, and that's by design.
What about patients that are underage though?
Patients that are underage, that is a different story. We do have those, and they usually are brought there by parents. Um, but with them, it's going to be less likely that they just stop showing up, and more likely that they're just going to shut down in your counseling session, and that's okay. That was another hard lesson that we had to learn, is that some people are going to shut down and some people are not going to want to talk to you, and that's okay. We want to facilitate control for the client. And so if we have a teenager that's forced to be there, dude, that sucks. If you don't want to talk to me, I can't make you talk to me. I'm not going to try to. You are in control of what happens in this room. And facilitating that control will usually kind of bring them out of their shell a little bit because, okay, wait, this is a person that's not trying to tell me what to do or, micromanage me or get me to talk about things that I don't want to talk about. I'm in control here. And so that gets them a little more comfortable and a little more willing to open up. And that may be instant. That may take a few weeks, a few sessions of me not trying to pull anything out of them. So I guess the core of self-blame and self-doubt is patience.
Patience with each other and the clients seems like sometimes things are not gonna go your way. So you gotta have patience, this patient, there's nothing I can do about it.
Yeah.
Which is a fair assessment. Sometimes we need to know when to take self-blame and when not to.
For sure, and there's always like a good healthy dose of humility. You don't ever want to get too big for your britches in this game. Um, I've heard horror stories of older counselors like thinking that they know absolutely everything under the sun, and that leads to clients not feeling listened to. So yeah, definitely like a healthy dose of I don't know everything, I'm not the expert is how counselors should approach most, if not every session. Um, that's how I was trained anyway. That's how I was taught.
Alrighty. You want me to go next, Micah?
I don't remember. Oh yeah, another thing is like I was talking about earlier with taking like clients needing to take different size steps, and you may misguess how big of a step that your client needs to take. It doesn't make new counselors bad counselors. It just means we have to adjust our strategy and be flexible. And I think that's something that applies in ABA too. Is sometimes things don't work, and we just have to be flexible and come up with a different plan.
Well, definitely.
But that doesn't
Flexibility
mean
is key.
that doesn't mean that anybody failed. It just means okay, we gotta change it up. I think the only way that you can fail is if you get too rigid and you get to where you can't see when things need to change and when your approach needs to change. It's kind of like with parenting. You know how they say like thinking that you're a bad parent can be the mark of being a good parent, and like truly bad parents think that they're great parents. A little similar with counseling. Like if you're getting too big for your britches, you may need to take a step back.
See, that reminded me of that, of always striving to be the best version of yourself, always. Not being complacent with where you are.
Right.
And being like, well, this is good enough.
And not being complicit with what you know. Because new research is coming out all the time, and new knowledge, new context with your clients are coming out all the time, and you never want to get comfortable thinking that you know everything. That's why counselors have continued education requirements and things like that, so we are constantly learning, constantly staying on top of the latest research, and that's required of us.
That is a thing across the board, though, because I know on ABA it's the same thing. There's new research being done,
and it should be like that's if you're working with people's lives and minds and health, you need to stay on top of it, and you can't get too comfortable.
100% agree.
But there is that balance of if you're too self-doubting and you get too caught up in I don't know what I'm doing, then you're gonna stress yourself out, and that's gonna affect your performance. So it's finding that balance between like self-deprecation and massive ego, finding that equal balance. That's just kind of humility, if that makes sense.
I mean, it makes sense to me, honestly. I don't see how you can provide the best service by just thinking you know best.
Right. Or thinking that you don't know anything at all and you don't know what you're doing. And I'm like, oh, like I don't know what I'm doing here. Your client is going to pick up on that. And you're both going to be sitting there like, ah, what do we do?
So if you don't trust your own skills, the client is gonna pick up on that.
Yeah, and then they're not going to trust your skills either. If you don't sound confident, they're going to be like, why don't you sound confident? And then that's gonna impact your counselor client relationship too, because it's gonna erode that trust.
Yeah, it definitely seems that you have to find like that little line between confidence and humility
Yeah,
to provide the best services and understand, sometimes it might work, sometimes it doesn't work, and that's okay.
we gotta roll with it.
There's a another patient that is gonna need me. I cannot be, blaming myself because
Hmm.
I wasn't able to help this person.
Yeah, I wasn't what this person needed, but somewhere down the line, there is going to be someone who I am exactly what they need. Okay, I think that is the conclusion on my theme for this podcast.
All right, then I'll jump in with my theme. So I chose compassion and inclusive applied behavior analysis.
All right.
So this means prioritizing the client's well-being and autonomy and dignity over the process of their learning and working on their skills.
That's what I'm talking
So
about.
reason I chose this topic is ABA has been around for years and it has a bad history and a bad reputation. And nowadays, we have to be able to highlight the fact that compassion is a really important skill that technicians and the BCBAs themselves need and are pushing forward.
100%.
In my classes, it has been a common theme. Everything usually revolves around the theme of compassion and including these skills into the program. Um, So, compassion can be a lot of different things. It can be respecting the client's preferences, taking into consideration what would be the best way to go about a program, or even the best way to talk and communicate with the clients. I think people get lost on the fact that, the clients have some deficits that they forget that they're all actual human beings that you can talk to.
Yeah.
Um, Micah and I, we worked on an ABA clinic. I still do. Micah worked with me before. And Micah has seen how clients act differently with different texts,
Mm-hmm.
depending on how compassionate and how trustworthy the clients find those texts to be.
And empathetic, I find. Like, if you. Like, they responded so well. I think they responded as well to me as they did, is because, I am also on the spectrum and I have a lot of, like, similar, if not as extreme, deficits and struggles. And so, like, I approach that from, like, a empathetic perspective. Like, yeah, man, it is really loud in here. Or, like, yeah, I don't like it when my peanut butter jelly sandwich has crust on it either. We can take care of that for you, man. I just need you to ask for it. And when they see that you care and that you want to help them and you're trying to give them those tools to get that help, they respond a lot better than just, I need you to do this before you can, you know. But
Yeah,
that's
I think a lot of
true.
people get.
Go ahead.
Yeah, I think a lot of people just believe that being compassionate means being, oh no, you don't have to do this, you don't have to do that, and being like less effective, and things are not gonna work because I'm being soft on you. And that's not really about what being compassionate is about.
Mm-mm.
It's about just showing respect and actually teaching the skills in a manner that is human like. Like the
Yeah.
kids are not robots.
They're not
Like I would not
robots. They're
listen.
not. They're not robots. They're not animals. Um, They're human beings. They're tiny human beings. They're developing human beings. But, they're people and they're going to grow into people and we should treat them like people. This does remind me a
100%.
lot of like one of the core things in counseling, which is unconditional positive regard, which is no matter what, you are seeing your client as a good person. Like, you are not judging your client, you're not thinking negatively of your client, you are holding them in a positive regard no matter what. Because at the end of the day, this is somebody that's coming to you and asking for help. And so when people feel
Think
judged or when they feel stifled or like they're just constantly doing something wrong, that affects them and that affects the relationship that you have with them. Um, Using those like kinds of empathetic and understanding approaches with anybody is going to see better results.
I don't. It's understandable, ABA is a field that causes a lot of mental exhaustion, but at the end of the day, most of the time, not all the time. There's different ABAs. Obviously, there's people that are older, and you can also work with them. Although I don't have experience working on that field specifically, I work mainly with kids under the age of 16. I am conscious that I'm gonna have my days, and it's valid. It's an exhausting feel, but at the end of the day, you're working with kids. Like, this is, and these kids are looking at you as a role model and learning from you. Even if they're verbal or non-verbal, even if they cannot communicate, these kids are listening and looking at you. Um, so showing compassion and properly, treating them with dignity at the end of the day, treat them the way that you would like to be treated. I think it's a big thing that is being pushed, but it has to be, pushed harder in the field as a whole.
Yeah,
Um,
you said that was
'Cause
being pushed like in your graduate program, right?
it is,
Yeah,
yes, it's like a big thing across all my classes. They always bring it up. Even my teachers, they just highlight it on every single thing that they do, and they explain. They're not trying to hide the past, but we're trying to change and do better.
for sure.
And there's different ways that we can go about this. There's different ways that you can show compassion. Like, what the most important one, give the kids a voice. What do you
Hmm.
want to do? How can we do this in the best way? Be creative. Um,
And
I think that
that's another counseling foundational skill is facilitating control, giving them some autonomy and the ability to make their own choices. That's good developmentally for children as a skill to practice, and that's good for building trust and rapport.
I have noticed that a lot of people just get lost on the programming and on the data.
Yeah,
And I understand, we have data to take on the field. ABA is a data driven field, and it's really
behaviorism
important that
usually is.
yes, it's really important that we take these data. But that does not mean that I'm gonna sit the kid on the table for 5 hours running programs. That's not healthy for the kid or yourself.
Mm-mm.
You're stressing yourself out and stressing the kid out. And more likely than not, that kid is gonna, blow up on you and show some challenging behavior.
Or shut
While
down.
it's, yeah, of course, and valid. I
Like,
would
I'd
shut
shut
down if
down
it was
too,
a
man.
kid. That's what I'm saying.
Someone
Like,
was
I
telling
could
me to
not.
like pick between three cards for like 5 hours. Yeah, I'd be picking random ones to get through it faster too. You
I'll be
know?
throwing the cards on the floor.
Right.
Well, how about you go and pick the cards? It's valid. That's why we gotta be creative, and there's ways to go about it. You can run a program in a million ways. Like, if there's one thing that I've learned from my teachers and my supervisors is that a rec ID program can be run in a lot of different ways.
Hmm.
It doesn't have to be at the table. It can be at the floor. It can be at the wall. I have one of my BCAs told me, how about you start writing with an expo marker on the window and see if the kid likes that. It is a way. There's ways you can be creative,
Yeah,
but
I when I still worked at the clinic, I would run Rec ID while taking a walk outside. Like grass, rock, flower, like we would, and
like
then
as I take myself,
yeah,
if you have doubts, oh, you can always ask your supervisor. And if the supervisor is going ethically and following the codes, they will promote this compassion, and they will adapt to the most compassionate way and effective way to provide this programming, because it's basically what we thrive for and what we are supposed to be doing as members of the field. It is on the codes. You're supposed to give the most effective treatment in the least intrusive way. This is nothing new. We just gotta apply it.
oh yeah, and I feel bad because we've been kind of ragging on like BCBAs and the ABA field for a little bit. Um, I do want to put out a disclaimer that we do have uh counselors who will also approach things from a less than compassionate stance, and that's not where we're supposed to be either. There is this thing that I think affects both BCBAs, technicians, and counselors, which is compassion fatigue. And that's when you've been in the game too long. You've had like you've had a lot of stressful cases, and your well of compassion is dry. And that can happen to anybody. That happens to normal people. That happens to people who take care of like chronically ill, terminal patients. It takes a toll, and we need to check in on that as not medical, mental health professionals. We need to make sure, okay, wait, am I approaching this from a compassionate perspective? Do I need to take a break? Do I need to take a vacation? Do I need to get some supervision? Those kinds of things. We need to be tapped into that.
Yeah, we need to be mindful that if I am burning out, I need to identify that I need a break.
Mm-hmm.
And I understand we were gonna feel with kids and whatnot,
We tell
and
them
even
to
if,
say, take a break when you need a break. you
yeah,
know?
you also need to take
You
a
also need to
break.
take
You got
breaks.
And I wasn't planning on going this route, but something that does happen a lot is, there's a lot of people that work on companies that the treatment and the text is not a priority. And even though I wasn't gonna go that way, it is said widely on the field, there's other companies out there. Like, don't just give up on the field because you work for a bad company.
Yeah.
Your mental health is important just as much as the kid treatment is, and we have to push compassion, not only with the client but also with the techs.
Yeah.
Like, we are the ones on the floor. We are the ones
Those,
getting
those are
spit
the
on,
those are the frontline
thrown,
troops. Like,
cursed at. I mean, we also need a break, and we also need to realize that it's not only compassion and dignity with the client, also compassion and dignity for ourselves.
yes, 100%.
And nobody's gonna look for you better than yourself.
If you are preaching to clients or friends or whatever, like, hey, check in on yourself, take a break. If you get too stressed out, take that advice yourself. Practice what you preach with those kids. Jose.
I do need a break. I do need
Uh
a break.
huh. You don't?
I do.
You do.
I'm honest
Okay.
about it.
All
Yes, I
right.
do. I do. All right, Micah. Let's jump into the fun part.
Okay. All right. Let me see. Let me
All
pull up my
right,
notes.
yes. So we are about to do our little analysis of our little characters. So for this trial version,
I want to
we
preface this
chose.
with Jose and I both play the hit MMORPG Final Fantasy XIV. It has a free
100%.
trial up to level 60 with zero limits on game time. Actually, level 70 now, and it includes the base game Realm Reborn, the award winning expansion Heavensward, and the expansion Stormblood.
Not the whole
Um,
promotion.
hashtag not sponsored.
So, heads up, spoiler alert. Um, at least from my end, I don't know what Micah has. Um, but for my analysis, I had to do a functional analysis. So the way that we're gonna go about it is, Micah will go over how their character would be assessed on the counseling field, and I will do the same thing on the ABA field, running a functional analysis for my character.
So they
I
are
will
two
say
different characters. We're not comparing and contrasting the same character.
yes.
Yeah.
I will say we're still students. It's
Yes,
not
we
gonna
are
be
still
perfect.
students. Don't come for us, and we're also analyzing like fictional characters with very concrete and set themes and things like that. So we will be doing a lot of speculating and assumptions that we're not like as counselors at the very least, like we're not really supposed to do so much, but it's because you know Mario from Mario's not sitting right in front of me and I can't ask him, so we're gonna speculate based on what we've seen.
All right, Mike, you want to go first?
Sure. So spoiler alert for Endwalker expansion of Final Fantasy XIV. If you're going through 14 and you haven't gotten to Endwalker yet, you may want to skip my part. Um, but the character that Jose gave me was Fandaniel from Final Fantasy XIV Endwalker. He's kind of one of the antagonists in that expansion. Very nihilistic kind of ancient being that has been around too long. His whole thing is that everything is eventually obsolete and pointless, and so what is the point of anything? And we should all just take a nosedive, basically. Um, so, with a client like this, we see the presenting problems of suicidal ideation, to a degree homicidal ideation, because it's I want to die and I want to take everyone down with me is Fandaniel's whole thing. And we find out later, because he's also Amon from the Crystal Tower raids, that it's almost a degree of prolonged grief, because he was very attached to King Xander, and so when that whole empire fell, that was kind of the core memory that led to a lot of his issues later. So when we see a client like this, first things first is we want to assess for intent, safety first. If we have a client with suicidal ideation, we want to make sure that it's passive and not active. There's not a definitive plan to harm himself or others. If it's active, we gotta get him committed. We gotta make sure that he's safe, and he can come back and we can deal with it when that is more stable, because safety is always first priority. If it's passive, he's in a space where we can actually, do some work. Then I think I would take a person-centered and existentialist approach. So, person-centered is Carl Rogers, unconditional positive regard, giving the client control of the session, as little of yourself as the counselor in that room as possible. It's a lot of reflecting back and kind of letting the client come to their own conclusions. That is kind of my preferred approach. It's kind of how I do it in That's kind of just how I do it. But I would also like to sprinkle in some existentialists, because a lot of his mindset is nothing matters because everything eventually goes away. And the core thing of existentialism in counseling is, yeah, we do have a finite time here. Nothing is going to last forever. And ultimately, none of it is going to matter. That does mean that we can do whatever we want with it. And we can make this life whatever we want it to make of it. And just because that it's going to end later doesn't mean that the present doesn't have value. So starting out, I would meet him where he's at. He doesn't think that life has any meaning, and I'm going to do a lot of person-centered approaches and like reflect that back to him and really empathize with him and understand where he's coming from with that. Because, first we have to have that base understanding and that trust of, I understand where you're coming from. I see where you're at in your mind. I see your worldview before we can even start to try to challenge it. Because if we just come right out of the gate with you're wrong, what's the client going to do? Shut down. They're going to shut down immediately. You will never see that client again. So we want to build rapport and understand that worldview before moving forward. So with the existentialist approach, we would ask, we would explore things like, what does he want to do and what does he want to see in the world? How can we make that happen? How does he want to live? How does he want to be? What is his ideals? What are his values? So that we can take those values from inward and apply them to the world. Because a lot of, I think, what Fandaniel's nihilism comes from is that there are no concrete rules externally. And so we have to find them internally and apply them. Something that my counselor actually told me once was, he doesn't treat others mean or kind because of how they have treated him. He treats people kind because he's a kind person. It's got nothing to do with the person in front of him. So it's that intrinsic value that we are using to facilitate our behavior. A big theme with him is that eventually, everything is consigned to oblivion. And I think that a gentle challenge would be that, eventually, everything goes away. Everything is finite. Does that change the good that it did in the present? I'm gonna quote Kung Fu Panda here for a second, but yesterday is history, tomorrow a mystery, but today is a gift. So I also think, taking a focus on eventually in the future everything's going to go away, but what's happening right here in front of us? What's happening in the present? What is the present moment? How can we live there in that present moment and take it for what it is? And beyond that, it would just be kind of taking it where Fandaniel would want to take it. I can't make any kind of guarantees or assumptions that he would respond to my approach, but that's how I think I would start to approach it.
And the question that I think everybody will be having right now is, do you think there's a way that we can help these guys?
I think there's a way that we can help anybody that wants to be helped.
Trying to remember if this guy wanted some help, because I think we try to help him, but
well, if he's coming to counseling, I am assuming that he's wanting help. That's kind of the beauty of the counseling field, is that 9 times out of 10, not every case, you have some court-ordered cases, you have some, I'm forced to be here by my parents, I'm forced to be here for whatever. You have cases like that, and there are ways to still, get somewhere with those clients, but for the most part, people are there because they want to be there, they want help, and they want something to change.
That's awesome, Micah.
Any questions, comments, or concerns, Jose? This is a podcast. This is a discussion-based podcast.
With Fandaniel, honestly, it would be really interesting to see him on a counseling session.
I think there are a lot of characters that are like, this guy would never go to counseling, but we're gonna pretend for the sake of like podcasts. This
Yes,
man would
nah,
never sit in my
definitely.
chair. Like,
Yeah, not that one. I don't think so. But hey, look, that's the beauty of this hypothetical.
yeah. And I think if he was like a court ordered case, like let's say he wound up in like ASEAN jail or whatever, and he was court ordered by Elidibus or whatever to seek counseling. I think it would take some motivational interviewing to like kind of see like, okay, man, what are your goals? What are you wanting to achieve? How is that feasible? What are some feasible, achievable goals, etc., etc. you know,
I wish I could say this. It would be beautiful. I will sit the whole way just to watch it and see the progress.
I think progress would be very slow going. Like that would be because it's also like trauma there. He watched his entire like great empire collapse and fall into like namelessness, basically. All like nearly forgotten, and so that's definitely a trauma case, and so you'd also kind of have to take like a trauma informed approach to it too, because those thoughts, those feelings, those emotions, they come from somewhere.
Now, Madu was definitely about to crash out.
Oh, he pulled up crashing out.
Ah.
We can say that because he's fictional. ECA,
All right,
don't come for
since
me.
remember, we're still students. This is hypothetical.
We're students, and this is a silly, not serious podcast that we're doing to hang out.
True facts. My turn.
Okay.
So my character is one of the most obsessive villains of Eorzea.
This is still Final Fantasy XIV, by the way. This
Yes.
guy shows
Yes.
up in Stormblood, so you are playing 14 or have intention to play 14 and you haven't gotten to Stormblood, or, a lot of pretty much like throughout the game, but he shows up in Stormblood first. Maybe don't listen if you care about getting spoiled.
Good thing Micah knows because I will not know exactly where he started. So
Yeah, no, we see him in Stormblood, like he beats us up.
my character is one of the main villains of the game. I might not say his name right. He's most of the game. He's there.
He's there. I don't think
I'm
he's the main anything except for
well,
Stormblood.
we can agree to disagree, Micah.
I'm not saying that
Um,
he's insignificant in other parts, but he's not the main big bad,
all right, to be
except for
fair,
in
we do have
Stormblood.
an inside joke between my character and this
Yes.
character. So,
So the
so
context
my
here is that Jose does have a strange infatuation with Xenos.
I do
Yes.
not. I do not. I think it's funny. But yes, my character is Sinos Galvas. I think I said it right. Maybe not. Who knows? Um,
Xenos C. Galvez, yep.
and so obviously ABA is a little different. We find deficits, challenging behavior that we try to adapt or change. I would not say change because I don't like utilizing that terminology when we talk about helping somebody gain a skill or replace a skill that they have for something that is more positive or appropriate. Um, but remember, this is a hypothetical. This is Xenos. In his world, he doesn't have salvation, so let's just go with what we can do. So I ran a functional analysis. I looked at some of his behaviors, and we're gonna try to see what fuels his violent pursuits and how we can understand a little bit of his behavior with some of the ABA tactics and things that we have been taught throughout the years. So to start, let's see what are we looking at? What is the main behavior with Xenos? And his main thing has always
Additional
been
context, I have personal beef with Xenos, so I'm going to be making faces this whole time. It's not at any ABA anything, it's just because Xenos is being mentioned. And as a gamer, he upsets me.
So his main behavior has always been, he actively initiates combat with powerful individuals, countries, mass destruction, evil stuff. You think about it, he does it. Like he provokes war, escalates confrontations for no reason whatsoever. So this is what we're looking at. So observable things will be, invasions, engaging in duels, which is a common theme with this guy. He's always trying to throw down with the strongest individual he can find.
So is that in and
So
of itself considered a maladaptive behavior, or is it like
well, these are some of the observable behaviors that he has. Some of the
okay.
bad things and things that we can change. On ABA, if it's not observable, most of the time we cannot, adapt ourselves to it. We do take into consideration some of the emotions and things like that, but we mainly focus on observable behavior that can be um
Measured?
basically. So in the case of him, it would be, the invasions. You can count how many invasions, the engaging on duels, how many times he does these things throughout the story and throughout the game itself. Um and based, I did like a little bit of functional analysis of him. Obviously, I didn't take all the data. That would be crazy. Um but for him, my analysis ended up showing that, he does not seek attention for his own people. So in this case, we counted like the Guardians to be his stakeholders. That's where he's from, and he doesn't really care about them that much throughout the show. Throughout the game, like he does wants attention from somebody else, but I'll get back to that in a second. He does show some escape and avoidance behaviors from
Okay.
his political and his, social expectations in his country. He doesn't want to be the king. He doesn't really want to be, in control of that stuff. He has other priorities on his life than his own people.
That's interesting. I never read that as like an aversion to it so much as just more like a disinterest.
Which could also it could go either way, but to based on the context to kind of make it a little bit more realistic.
Okay.
Since I'm counting the Guardians to be part of his people, he has his responsibilities that he doesn't really care. Does that make sense?
Yeah.
So, um, tangibles, he doesn't really want anything. He's not attacking for any control of any item or any country that he wants to portray. Now, what does he want, right? What does he want? So he has automatic, reinforcement. He
Motivational
wants to fight.
operations.
He wants to fight to feel alive, which is why he's always trying to throw down with the strongest individual that makes him feel alive, that makes him feel good, which is some type of automatic reinforcement. He doesn't need me or anything. He just needs to engage in this behavior to reinforce himself. And he also wants access to a specific individual. He's hyper fixated on the strongest character of the game, the player, or how we all know it, the Warrior of Light. So these are the things that he wants. And he usually engages on and tries to manipulate events so he can see this guy or this person player all the time and battle him to get that automatic reinforcer. Um, which, you could argue that that's some sort of attention because he wants the attention of this specific individual. But when you mention attention, I think about, in general, does the person want attention from everybody or just somebody specific? And in this case, he wants the attention of one specific person throughout the game. Um, so things that cause these behaviors: when he gets ignored, when there's, situations involving waiting, inactivity, or political rest. These were things that will bother him. Like whenever the Warrior of Light was not engaging with him, he would get really upset about it. Even towards the end, like whenever the Warrior of Light was doing something far away, and he felt that he was getting left out, he flew all the way over there. Um, so like that waiting for the challenge, being bored, these are things that would just get him upset. Um, Consequences, what will happen whenever he will get his way? He will get, his feeling. He will feel alive. He will get the Warrior of Light to acknowledge him whenever he would engage in these behaviors. So I got a little intervention in here that I got for him. But before we continue, the summary of what we just talked about, he engages on the destructive combat and aggressiveness behavior that is maintained by his, automatic reinforcement, like the Warrior of Light, and him feeling alive every time he does these horrible things. Um, so how can we fix him? uh Complicated. It's complicated, but we're gonna try. So
Good luck with that one, boss.
yeah, so we can teach him some functional communications. Ask somebody to fight you. I don't know, like communicate what you want.
I don't think
Well,
like verbal communication is a big struggle for him so much as just tolerating no.
So functional communication doesn't necessarily mean that the person cannot talk. It's
Right.
more that they're not using the right words to communicate what they want.
Sure.
So in this case, he would just throw down with you instead of being like, "Hey, just fight me." Which towards the end, when he did use functional communication,
He did.
it happened. So it is a skill that he learned to use at the end of the day.
I was trying to
um,
like, and this is so. I'm sorry. Go ahead. I'm sorry. I keep interrupting.
no, no, go ahead.
Um, I was just thinking like it's not that I don't think he doesn't know to ask or that it's not a habit that he has or that he could engage in. I think it's a refusal to accept no as an answer, and so he's trying to set up the board so that no can't be an answer. And so it's
which
it's that denied access that he's trying to prevent.
which brings me to my next methodology, which is DRA, differential reinforcement of alternative behaviors. So in this methodology basically works. Well, this yeah, um, you will reinforce alternative behaviors that are not, destruction or things of that manner. So instead of, every time that he destroys something, well, although in this case it's a little complicated because we're using somebody that is destroying countries. um, but let's, on this hypothetical, you will not reinforce that. You will not engage with him when he's doing that, and you will try to engage with him when he's actually asking for or doing something in a better manner than destroying a country to get to that fight and get that automatic reinforcement. So it could be, asking, it could be helping you to do something to earn that reinforcer. It's a little silly because I'm saying this and I'm thinking of the person that I'm saying it about, but it is what it is. Um, and then the other option, which is, extinction. Um, you know, One thing about extinction, outside of this hypothetical, this is a thing that cannot be done without asking permission to the board. No tech should be doing it without consulting with their supervisor, and the supervisors need to consult with somebody else. So remember, this is just a hypothetical. And even on this hypothetical, if we take it a little realistic, it's not a good idea because of the behavior that Xenos engages on. But yeah, withholding the reinforcing outcome, not engaging with him when he wants to fight. which in the game we kind of did that, and he
Yep.
ended up doing positive things, which ended up getting him his reinforcement at the end of the day.
Yeah, I think it was a combination
Um,
of extinction and Alize kind of hitting him with a hard truth. And so it was it was kind of a combo ABA and counseling technique of not reinforcing the behavior and still like also confronting that behavior and the purpose of it. Spitting in the soup a little bit is kind of what Alize did.
the thing that I like the most about this example and going over this character is that even on this hypothetical, there's certain things from it that can also be applied to real life.
Mm-hmm.
These are actual techniques that you can use, and you use on your daily on the clinic. Like, not all the time when you're engaging with the kid or reinforcing when the kid is behaving properly, you're applying this DRA because you're reinforcing when he's doing something completely alternative to the target behavior. So this is something that happens. Um, but yeah, I just think it's interesting how still on this crazy hypothetical, um, is still
Yeah.
applicable, and there's some things that you can learn from it.
Yeah. Apply behavior analysis to this war criminal.
Yeah, it's complex, but we try. All right, jump into our next section, Mike. The news. What news you got for me, huh?
I started last time. I think you should go first this time.
Okay, sure, I'll go. So as a member of the field, we recently got the the letter. It has an name. I forgot what it was called. Um, we got a letter on March. Was it March? No, when was it? I think it was February. Yes, we got the March newsletter. Yeah, I'm sorry. So, yeah, I had it on my mind. I don't know what. Just went blank. So, recently we got the March newsletter. And, in the letter, they brought up a lot of changes to, the coursework and stuff like that. I'm not going to be going into that because I'm still a student of the field. One thing that does has caused a big uproar on the community as a whole has been the removal of the DII, which those who don't know is the Diversity, Equity, and Inclusion Act,
DEI.
or
Okay. Yeah.
this is DEI. I'm sorry. Um, and back on 2022, they have brought up the fact that they were going to add new requirements for the 2027 um testing and programming, and they were going to add this um courses to include, diversity, equity, and inclusion on programming and applied behavior analysis. Um, but back on March, they brought the news that they were not gonna, continue with this, and they were gonna eliminate the DI content from the coursework. So a lot of people felt that it was a big step back on how the field was going. Since now this will not be a requirement, and whenever you're studying. So this coursework would not be, which if you think about it, if you go, well, that means it's less schoolwork. Yes, I guess, that's the only good thing, I suppose, but not in a good way. Because I do believe that diversity, equity, and inclusion is a really big part of, how the field is moving and the compassion that I was mentioning at the beginning.
100%.
Um, and it's kind of sad. I will not, attack the board. They lead this. It's whatever. I do want to highlight though that, however, since this is happening, I do believe that, as a field, we need to, even if this is not a requirement, look to implement this diversity, equity, and inclusion on the field. Um, I know many like state boards have raised their concerns and their opinions on the matter. I know the Illinois Association for Behavior Analysis, they sent a letter expressing how this undermined years of efforts towards creating the inclusive spaces and developing the field in a manner that would include everybody. Because on today's society, this is really important. This is not just, oh, this is just rules that we're not gonna know. This is something that we deal on the daily. We deal with different human beings and individuals that they all have their personal lives, cultural beliefs, everything. And this is not just a random thing that is not gonna have any effect. This is something important. Um, you know, removing this possible learning also removes the opportunity for future students of take this into consideration on their studies, because it's not a requirement. Now it's just left for us to take into consideration if we want to apply this or not, and that is really dangerous in my opinion. As a technician of the field, I've been a member of different groups. I've worked with different individuals, clients, techs, different cultures, religions. It don't matter. At the end of the day, we have to be inclusive and provide the best services that we can. Um, I have been trained to foster inclusive and compassionate practice by my supervisors, by my teachers, and I think this is questionable, but it should help the field to get closer to promote this this diversity and equality across the board with patients and technicians and even BCBAs. It doesn't have to stop on the techs or the patients. It can be across the board, and I do think it's really important that we highlight this because this is something important that happened recently and was a big deal for the whole board. Um, what are your thoughts, Micah?
Uh, yeah, I agree that it sounds like a bit of a step backwards because we, as mental health professionals, we work with the public. We work with different people from all walks of life, and that's something that needs to be acknowledged and understood. If you have these kind of general apply to everybody kind of mindsets with programs and uh, regulations and rules and things like that, you run the risk of not giving the most effective therapy and treatment that you can give. Um, it
I
does,
have been.
it feels like a
Go
step
ahead.
backwards, and
I
it
have been a
it
little happy on how the community itself has reacted to it though, because
yeah,
even though the board themselves did this, like the community and all the BCBAs technicians, it kind of got us a little bit closer
yeah.
on this big deal event that recently occurred.
It sounds like it kind of brought everybody together a little bit. It's good to hear. I'm glad that people are going, hey, 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 no. Because, like you said, with that not being a requirement in schools, like, I agree that that can be risky because you do have people that will go into the field with not the best mindset and not the most compassionate mindset, like we were talking about earlier, and not having that kind of context with different groups and cultures and everything can make that lack of compassion a lot easier. I'm going to quote Final Fantasy XIV now. But ignorance begets strife, understanding begets fellowship. The more you come to understand a group, the more human that group seems, and the more you are likely to treat them with respect and compassion. And so, taking that out of the curriculum and out of the practice will put a lot of um, kids, technicians, BCBAs in marginalized communities in a tough spot.
I think it's a big step back also on what they try to show other people that this is some of our ethical codes highlight the importance of utilizing newer research and the best methodologies to promote effective treatment and promote the best environment possible for clients, and eliminating a possible good thing that could demonstrate cultural competence and advocacy and reflective practice on how we're supposed to act with our clients and treat our clients and set an example. It's a big step back, but there's not a lot that you can do from a tech point of view, or even a BCBA that has no voice on the board. All you can do is try to communicate to others that are listening. Hey, even though this happened, we still gotta move forward and promote and follow these ethical guidelines that we have, because they're there for a reason.
Yeah.
So even if this is not set on stone, you should still be promoting the diversity and including everybody, and not
Yeah.
limiting your treatment to certain groups of people, because you're not following the ethics. And we're in a field to help. This is a mental health field, and I'm gonna be honest, if you're not helping, I don't know what you're doing.
And, that's the thing too. Even if the board says that it's okay, it's still on you as an individual, as a professional, to provide the best care for your clients. And I genuinely believe that that can't be done without understanding those clients and their backgrounds and where they come from. That
Agree.
cultural context is important.
100%.
And, even if it's not required, it's still on you. Kind of like with counselors, there are things that may not necessarily be required, but you want to be if you want to take this job seriously and you want to be effective, there's no way around it. It's going to come it's going to be something that you have to deal with eventually.
What you got, Micah? What are your news?
Okay, so a lot of the big like things that have been kind of shaking up the American Counseling Association here lately has been Medicaid reducing funding for mental health services,
Mm.
which means that a lot of counselors can't get reimbursed for counseling clients. Now, I don't know how it works with ABA, but in counseling, we have an ethical obligation to see a client through to the end. If anyone is going to terminate that counseling relationship, it's going to be the client. Unless it's something like serious thing that we aren't specialized in, or some like serious extenuating circumstances. Ethically, even if they cannot pay, if we don't get reimbursed, we still have to see that client and continue
So hold on, you'll be
counseling.
working for free?
Yes,
Ooh, that's tough.
because ethically we can't just abandon our clients. And
And how would that go, Micah? Would you like have the client pay?
so that's where like the big problem is coming from, because it puts counts a lot of counselors at risks for financial jeopardy, because they can't just stop seeing the client. Now we do have like some things that we can facilitate in order to make sure that client is receiving services, and we can still be in a place where we can provide services. Like the barter system is something that is completely like free and clear and ethical in counseling. Um, so like if you are counseling a mechanic and you're like, hey, I can't swing my copay or whatever for the session, but I could change the oil in your car or change out the brakes in your car. As long as what's being offered is equivalent to what is owed, like in a monetary sense, that's fair game, and you can do that. There are ways that clients can pay for sessions without necessarily paying with money.
Oh, that's really interesting.
Now, like, it does have to be like equivalent or is like really really close to equivalent. You can't just accept like a Tiffany and Co set of earrings for one session because that's value of the gift or the barter versus the value of the service. They have to be equal for it to be ethical. But that is something that we can do.
I'm sorry, this might sound a little silly, but so does it mean that if let's say, hypothetically your session is $30, I can give you 2 cases of Coca-Cola and that'll be worth my session?
Yeah. I mean, I would have to, like, the barter system isn't something that's like mandatory or required. It's just
Okay.
a way for you to facilitate your client to be able to pay for services. So like, if I really like Coca Cola or I'm down to accept that, yeah, you absolutely could.
I think
That's
that system is
usually,
kind of cool,
yeah,
but
and
it's a little messed up.
it's reserved for like people that are in a spot they physically can't
Mm.
pay. Um, it's not just, oh, I don't feel like paying it, so but I have these 2 cases of Coca Cola. Unless I don't know, client really, I mean, the counselor really really likes Coca Cola. But yeah, barter system works. But it could still mean that clients and people who need counseling services won't have a way to start receiving counseling services, also. And, you do have clients that are like, oh, I can't pay for it, I can't cover it, so I'm going to stop going, regardless of what my counselor, says that we can still do session. So that's something that's kind of scary in the field right now because you also have to take into account, Medicaid and like the government insurance is kind of what gets the ball rolling for private insurance. Typically private insurance won't start covering something until like Medicaid, like government insurance starts accepting something. So I'm a little nervous about like other insurances seeing, oh, okay, Medicaid's not doing that, so we don't have to do that either. It could just mean that a lot of people will not have as much access to the services that they need.
And I was gonna ask, um, what is causing this? Is it like a government agency trying to shut it down, or
Oh yeah.
how? Like, what started it out?
Um so, Doge is trying to make all of these government cuts and reducing the size of the government in a way that doesn't really facilitate a lot of alternatives. And so
Mhm.
that's putting a lot of the American public in a bit of a spot. Um, but yeah, a bunch of cuts are happening across the board right now, and Medicaid and Medicare is definitely one of them. And I've already heard tale of like people not being able to get their prescriptions or get like doctor's appointments, um, afford the care that they need because of all the cuts that are happening in the Department of Health.
Which is it's interesting because that's also like the main reason why the DEI programming was cut due to government anti-DIE groups.
Mm-hmm.
Um, so it seems like that is having a whole effect on the whole thing.
Yeah, and I don't want to like pass any kind of hard judgment on anybody's political beliefs or alignments. So I'm trying to be very careful with just saying this is impacting, like X is impacting Y. and these are going to be the consequences of this happening. But that's one of the big things that keeps rotating around in ACA emails and newsletters. Cuts are happening. Start preparing for that.
All right, Micah. We've made it to the last section.
All right, we're back to silly stuff. Let's do it. What a tone shift.
Oh, you ready for your character? So, last section, what we will do is give a little debrief, a little background on the characters for the next video. And this is just a little background to end in a silly, no, well, silly, depending on the character that you're gonna get.
Lighthearted, shall we say.
Sure, let's go with that. So you ready to know what your characters are gonna be?
Hang on, let me get ready to.
So I will say you never heard of this character. Well, you heard one time, but you don't know a lot about this character. Let me know when you're ready, my friend.
I'm ready. I'm scared. You're already giggling. That's not a good sign.
So your character will be Jin.
How do you spell that?
Jhjhin. He's a character from League of Legends. He is mentally challenged.
What does that mean?
He's an he has a killing habit. So I'll explain. He is introduced as a psychotic serial killer. He thrives on creating art through, getting rid of people, and he sees it as some sort of performance. So this is a serial assassin. It's a tough character. Some personality traits. He is highly methodical, super calculating. Because killing for him is an art, so it has to look perfect. So if it's not beautiful, it's not. He doesn't like it. So he treats it as a form of expressing and composing art, like a symphony, like a song. He has an obsession with control, but this is more for you. So I'm just gonna stay away from this, mental things. I would say he does have a calm demeanor when he has these violent tendencies. It's not like he loses it. He's super calm through it all. So a little backstory: he was a prisoner. He was in confinement and employed by the government to eliminate political enemies. Nonetheless, he became super extreme with his art, and his behavior started escalating to the point that he became a serial assassin. Because he wanted to create, this symphony of destruction and suffering.
Okay, was there any catalyst or event that led to the homicidal ideation and the violent behaviors?
So I don't think so, but he used to be a murderer, but then after he got his freedom from the government and spent this time over there, it escalated massively. Okay. I can send you like his story if you want me to afterwards.
And so when you say he's in confinement, was that like solitary confinement?
Yes. And then he was released and then employed by the government.
Okay.
What you got for me, friend?
So you made a little bit of a mistake by tipping your hand and already giving me a heads up that you were giving me some kind of, shall we say, antisocial character to analyze. And then you gave me the go ahead to release our first episode on April 13th. So I'm going to be giving you an alien juggalo named Gamzee Makara from the notorious, infamous webcomic Homestuck.
All right, I'm gonna have to read this thing then.
Gamzee Makara is from a. He was born into a high social caste, I guess is the word that you would use. Very well off upper society. He is in a cult that shares a striking resemblance to the Insane Clown Posse. And the presenting problems that we see with them is substance abuse, religious delusions, and violent outbursts. He is a little similar to what you were saying with Jin. Kills people, kind of gets a little freaky with it. His whole deal is that he is a juggalo, a clown, and he used substance abuse basically as a form of self-medicating for the religious delusions and violent urges. And then he has recently hit a point where the substance that he was been using is no longer accessible to him. And so this has led to an onset of religious delusions and violent outbursts. Do you have any questions? I'm not really there. Homestuck is one of those things that has too much lore in it, and we would be here for a million years if I got into every bit of it.
Nah, it's okay. I'll probably go and read through it.
Okay.
See what I can find out about the character itself, and just go from there. Because I think by just knowing his behaviors and whatnot, I should be able to get a functional analysis and see what's up with him, what he wants.
Okay.
All right.
Jose does have a strange infatuation with Xenos.
I do
Yes.
not. I do not. Mi friend, I'll be doing Gamsi Mecca from Homestuck. This should be interesting.
I want you to know, Jose, anybody who knows what Homestuck is and watches this just groaned and rolled their eyes. Jose does have a strange infatuation with Xenos.
I do not. I do not. As soon as we're in, I'm gonna send you the story of Jin.
Okay.
So you can just have the info for him.
And I'll see if I can find a good lore video on AMZ for you.
Oh, there's definitely something out there, I'm sure.
100%.
Alrighty, friend.
Alrighty, thank you anybody who came out to listen to our silly little podcast. It was a little rocky. We had a bit of a rocky, stuttery start, as I do with all things that I start for the first time.
Yes.
Um,
I do believe that for the next one, we'll be a little bit more comfortable.
yeah, and that's just going to be a trend. Each one we do, we're going to get a little more comfortable, a little more fluent, easier to talk, and we're going to have a better grasp on what we're doing.
Definitely. Still think it was fun. Had a good time. Bro, I cannot.
Brought me back to days in the clinic when we would just find something random to talk about.
True facts.
Which is, by the way, where the inspiration for this podcast came from.
True.
Jose and I would be working in a similar room, and we would kind of forget to work with our charges, forget to work with our clients, because we're talking about unconditional positive regard or whatever. So yeah, this is probably going to be something that we're gonna do. Probably going to be something that we're going to put out monthly, to the best of our ability. We are grad students; we get busy.
For real. Hopefully, in a month or two, we will. When do you finish, Micah?
Next year.
Orange, bro. Drinking air at this point.
Alrighty, thank y'all for listening, and we'll see y'all in the next one.
Peace out.
Don't forget to like and subscribe and whatever else you do on whatever platform this ended up on.